And I also realized that there is surprisingly an analogy between gastric band surgery and being busy. So the gastric band surgery of being busy is after undergoing gastric band surgery, people's risk of suicide tends to go up. And that's perhaps unsurprising because gastric band surgery is a big deal and can sometimes have complications, infections, painful outcomes. But one of the unseen reasons for this increased suicide risk is actually due to the surgery going right, not it going wrong. So you understand gastric band surgery, lots of complications, infections, painful outcomes, but it going right can have as bad of an impact on people as it going wrong. Many patients used food as a way to deal with issues in their lives, emotional challenges, loneliness, anxiety, and after having their stomach shrunk, the ability to use food as a comforting crutch has been taken away. But the emotional challenges that they were using food to deal with still remain. So the coping mechanism has been taken away, and it forces patients now to face their issues without a release valve. And I think that there is an equivalent dynamic happening when you try to elevate your life to take your sense of self-worth from things other than your work and your level of busyness. So let's say that in the past you used busyness and chaos as a way to distract yourself from feeling unwanted emotions. It meant that you didn't need to reflect on your decisions or sit in discomfort, that you're moving so quickly that you never fully connect with the things that are happening in your life. Lost relationships, disconnected friends, poor decisions, accumulated negative character traits, they're all swept away so quickly that you don't even have time to consider them by manic work rate. So eventually you realize that chaotic busyness is not your highest calling in life, and maybe you value different things now, or maybe you've outgrown that phase of your life, or maybe you realize that busyness for busyness' sake is detaching you from connecting to your existence. So the question here is, what happens when this coping mechanism gets taken away? You are forced to face your issues without the highly distracting release valve that you're used to. The busyness anesthetic that you used to previously rely on has now been removed, leaving you with two choices.